Envision a future where every clinic, lab, and pharmacy in Belize can speak to each other in real time, saving lives with information, not paperwork. That future is being developed right now.
The Ministry of Health in Belize is responsible for the entire health sector of the country, both the public and private sector. And so it's important for them to be able to access data for the entire country, to be able to monitor the health statistics of the country. It is important to have this data to inform planning, to inform policies.
Clinical Data Exchange Platform, CDEP, our health informational highway, will ensure interoperability between the Ministry of Health and Wellness and the National Health Information Systems.
The idea is to have an overall view of the clinical aspects of the patient, and it doesn't matter if he visits the private or he visits the public. We will be able to capture the data in one centralized hub. So the CDEP does include cybersecurity, privacy and data integrity through the system, in which user access is controlled by the Ministry of Health and Wellness. And it also contains data encryption, meaning that data cannot be compromised. The CDEP does have a backup system in which the information is being backed up in another environment. And this is very helpful for us because in the case of a natural disaster, any data breach, fault in the system, or any cybersecurity issue, we're able to recover the full information of the patient.
Soon, someone in Corozal will walk into any clinic. His allergies, labs, and x-rays follow him instantly, even if he has to see a specialist in Belize City. CDEP will pave the way and unify how our healthcare system works. Furthermore, it will enable more accurate, informed decision-making and policy planning, ultimately enhancing health outcomes across Belize.
The Clinical Data Exchange platform will allow for two systems. We have the Belize Health Information System that we use versus what the NHI uses, which is RAWA. Both entities have reached an agreement that we're now going to be able to share similar information, similar data. Once we're able to gather that information, we're able to tailor at the ministry level those policies that would benefit the public. From looking at disease trends, we're looking at budgets where they need to be allocated for certain risk groups, pregnant mothers, the elderly, the very young, immunization. So all of those trends we're able to now monitor closely. And we're able to have that now to model at a national level those strategies and those interventions that would be needed.
The possibility of having a fully functional CDEP is the result of sustained collaboration among institutions like the Ministry of Health and Wellness, the National Health Insurance, the European Union, and the Pan-American Health Organization, World Health Organization.
Successful implementation will mean that the country has comprehensive data, and importantly, to be able to integrate information from all the relevant sectors. We have the Ministry of Health, we have the National Health Insurance, and the Social Security Board, a civil registration, to be able to link to this system so that we do have timely, quality, and accurate health data for the country.
CDEP will shift the focus from provider-centered systems, where each system only cares about its own information, to a people-centered, patient-centered health information system.
The CDEP is at the heart of our digital transformation. In a sense, this platform lays the digital foundation for a more integrated, efficient and responsive health system, which in turn support better health outcomes for Belize.
The European Union-funded Health Sector Support Program Belize Project. Achieving a better quality of life for all Belizeans living now and in the future.